I'll on this, on, then bring it down. Hello, ladies and gentlemen, Malabites and Malabresses. A cool evening, and it's such a delight to have a cool evening after all the hot nights, the hot days of 2024. 2024 has actually been a very, very, very hot year from the past months. So we're so delighted that this is a cool evening, and I am glad that your head is settled because of the weather here to listen to our gist for this evening. We have something interesting for you this evening. My name is Patience Omini. I am a medical student studying medicine and surgery in University of Calabar, and today is World Hypertension Day. World Hypertension Day, May 17th. And here at the studio, I have two beautiful people with me. On my right, I have a very honorable gentleman, and on my left, I have a really beautiful, honorable lady too. So I would give them the floor to introduce themselves. So sorry, you can introduce yourself, sir.
Okay, good evening, distinguished Malabites and Malabresses. I'm Dr. Ezoke, consultant cardiologist in the University of Calabar Teaching Hospital. It's a pleasure to be here this evening.
So yeah, I right now I feel like standing up to give him a round of applause because this is our big man, our chair. He is one big person we respect so much in the medical field. He's a consultant cardiologist. Consultant, I say that again. He's a consultant cardiologist and a one-time CUMSA president. So he has headed CUMSA before and he has been doing exploits since then. And on my right, I have...
Okay, good evening, Malabites and Malabresses. I am P. Sudoka, the Vice President of University Medical Students Association. It's a pleasure being with you this evening. Thank you very much.
Thank you very much, Ma. This is my mama, the head of our Standing Committee on Health, CUMSA. So this program is actually sponsored by Standing Committee on Health, CUMSA. Right, and World Hypertension Day, May 17th, it's not exactly a special day, but there is this body, World Health Leagues, that is more like an umbrella body for national, World Hypertension League is an umbrella body for national hypertension societies, national hypertension leagues, right? So they're the ones that started the movement to mark Hypertension Day in a year. So the first Hypertension Day was on May 5th, right? It was on 2005, May 14th. And then 2006, it was shifted from May 14th to May 17th. So since then, since 2005, we have actually been marking Hypertension Day. So the essence of this day is just to raise public awareness on hypertension, right? And we have an outline for this discussion today, so we're not just going to be blabbing. We have an outline for this discussion. So we'll be talking about hypertension. What is hypertension? What are the causes of hypertension? Signs and symptoms to look out for as a layman. What will I be feeling? How will I be feeling to know that, okay, this is cause for alarm, I have to go see a doctor? What are the signs and symptoms to look out for in hypertension, right? And then ways to manage hypertension, to control hypertension. And then, of course, we'll be talking about the complications of hypertension and latest developments in the treatment of hypertension. So, of course, my doctor has the floor, and I'll be starting with the first question, which is, what is hypertension, sir? When, in simple terms, if you want to tell a layman, what is hypertension, sir?
Okay, thank you very much. I can refer to you as Dr. Patience Omini. I preach and prophesy that for you.
Amen,
you're doing
sir.
a great job, and
thank you.
I first and foremost want to commend the Calabar University Medical Student Association Standing Committee on Health. It's remarkable the job you're doing, and I salute your efforts towards public health awareness. It's something I want you to keep up, and I believe that in no distant time, your impact on the health sector will be calibrated. Hypertension, in a layman's term, to simply put, is we have what we refer to as the blood vessels. A blood vessel is like a pipe conduit. So
Okay.
the pressure in those blood vessels, when the force of pressure in the blood vessels leads to a sustained rise in blood pressure over a period of time, that's what we refer to as hypertension.
Okay.
So to reach this cutoff to define hypertension, we use two parameters, what we refer to as the systolic blood pressure and the diastolic blood pressure.
Okay.
So the systolic blood pressure, simply put, is the pressure in the blood vessels when the heart is contracting, when the heart is pumping. Whereas the diastolic blood pressure refers to the pressure in the blood vessels, that's the arterial vessels to be precise, when the heart is relaxing
Okay.
and filling. So to reach the definition of hypertension, you need to know what the normal blood pressure is.
Okay.
For normal blood pressure, for systolic blood pressure, it has to be less than 120 millimeters of mercury. For diastolic blood pressure, it has to be less than 80 millimeters of mercury. For hypertension, simply put, any blood pressure at 140 or above for systolic and 90 and above for diastolic is hypertension.
Okay.
So it begs the question, there is an in between. If you have someone that is between 120 and 139 for systolic, or between 80 and 89 for diastolic, what becomes of them? That's what we refer to as pre-hypertension. So basically, hypertension is when you have a sustained elevation of blood pressure, systolic above greater than or equals to 140 and diastolic greater than or equals to 90 for a sustained period of time. That is hypertension. This diagnosis has to be made in a methodological manner. So it's not just you catch someone for the first time, you measure his blood pressure, you say it has hypertension. So you must have measured the blood pressure on two different occasions, days apart to be precise. The blood pressure has to be measured accurately and efficiently. So when you're able to ascertain and do all those, reach all those definitive points, you can label someone as having hypertension.
Okay, so in simple terms, when you go to see a nurse, or maybe you go for a regular health checkup, and you know they use the device, the stats and all of that to check you, right? The sphygmomanometer, right? To check you, and then you ask the nurse. The nurse tells you your values, right? Ask the nurse, ask, right? We want you to ask. So when the nurse tells you it's 140 all over 90, so that's when you should start getting worried. For anything less than that, okay, my doctor, I'm trying to explain it. So malabites and malabrites, I hope you're understanding, you're following, right? So this is an informative section, this is an educating session, so we are trying to break it down. My doctor, he knows how to pour stuff. Even when we are on word rounds and all, at times I have to calm my head down to really understand him. So I'm trying to break it down now. So hypertension, right? When your blood pressure, the systolic and the diastolic, systolic all over diastolic is 120 all over 80 or something less than that is fine, right? And then when it's slightly above that, you should worry. But then when it gets to 140 all over 90, my dear, please carry your two legs and go to the hospital. There is cause for alarm, right? So that is just the simple term. That is just the simple explanation. So I guess at this point we understand that part. So now we'll be moving on to the causes of hypertension. And before I do that, I would love my mama to contribute. What do you have to say? You're a medical student. So my mama is, we're both medical students and we have our doctor here, right? So my mama, in cases where you've been in the hospital and you've met people with hypertension, it can be really, really dreadful. I've met a lot of persons myself that they are in critical conditions because of this. So what do you have to say about that? What's your feeling? How do you feel when you hear hypertension? What do you have to say to Malabites and Malabresses, ladies and gentlemen out there?
Okay, like I said, once again, good evening all. Hypertension, like my chief has said, it's something that we have to watch out for because it has so many risk factors, because they have the modifying one, they have the non-modifying one.
Okay.
For those risk factors, sometimes me being in the hospital, I've seen most of them. It now happens to even younger people.
Okay.
Younger people, normally on a normal note, then when we're still young, they say it's the old people's disease. But right now it's happening to younger people because of most of them, their lifestyle.
Yeah.
Because of their lifestyle, the kind of things they subject themselves to can also bring up this hypertension to most of them. being, some of them have, it's being inherited.
Yeah,
So without keeping to those lifestyle, they make it more worse. They bring it to the normal, their youthful age. So it's a dreadful thing, like you said. It's something that everybody has to watch out for. And my chief has already said that when you go to the hospital, there's also what they call the white collar hypertension.
Okay.
You know that when you go to maybe a doctor wearing the white, so you have to check 3 times before you even before you confirm that. Most of these people too, you know, a lot of eating of salt. Salt can be a risk factor. You know, the present
acts where you are like, this food doesn't have enough salt. You carry raw salt and
so all those things poses them to this present day hypertension. So being in the hospital, we've seen a whole lot of cases. We've seen a whole lot of young people coming down with this same conditions.
It's actually very sad when we see young people come down with this, because I mean, it's starting at an early stage. Before you get to old age, if you don't control it, it has already done a lot of damage to your body already. So it's really, really sad, but that's why we are here, to raise awareness about hypertension. So now we'll move on to the causes of hypertension, and I'll give the floor to my doctor to talk about that.
Okay, thanks for that question, but I think it's important to clarify that the reason why this public health awareness becomes imperative is that we have a lot of people moving around with undiagnosed hypertension.
Yeah.
The proportion of the world that is actually living with hypertension is about 1 billion.
Wow.
In a world in which the estimated population sample size is about 8 billion, that's 1 in 8 persons. We want to domiciliate it to Nigeria now. Nigeria has a population of grossly over 200 million persons. The prevalence of hypertension in Nigeria, the latest and most recent studies, is about 38.1%. Wow. So let's say 1 in 3 have hypertension. If you were to extrapolate that 1 in 3, that's about just roughly under 80 million people are living with hypertension. Wow. The reason why I had to highlight this is it's important to understand that because hypertension is unlikely to present with symptoms, a lot of people are going around with their normal daily lives and activities without knowing they have hypertension. Wow. In fact, to put it in perspective, we always work on what we refer to as the rule of halves. In every suburban population, maybe low socioeconomic country, the rule of halves suggests that half of the people living in that country or local palace don't actually know they have hypertension. So let's say we have a population of 100 people, about 50 won't even know they have hypertension. Wow. Out of the 50 that actually do know they have hypertension, another half of that 50 actually not receiving any treatment. Out of the 50 that are now receiving treatment, another 50 or half of them don't have adequate control. So we have a population of about 80 million people living with hypertension, but the percentage that actually they've identified their hypertensives, they are receiving treatment, and the treatment is optimal, is about 10%. So which begs the question, what now happens to the remaining 90%? That's why the scourge of hypertension is increasing. And why is this number increasing? For half of that population of Nigerians, between the ages of 20 to 50, account for 50% of the increase. So you can see that myth that hypertension occurs in the elderly is something that we don't hold dear anymore. Hypertension is common in younger persons. I was in clinic on Tuesday. I saw someone that has been treating hypertension for 4 years. Wow. Guess his age, he was just 22 years old.
Wow.
So he started treating hypertension for way back 18 years old. So you can imagine the scourge of what we are faced with. We have a sample or a large population that don't know they have hypertension, or if they know, they are not receiving treatment, or if they are receiving treatment, the treatment is not optimal. So this now leads to the proliferation of complications of hypertension, and you can be sure that that's why when you come to our medical wards, we have patients with complications of hypertension from stroke, kidney disease, heart failure, eye issues, and all variety of issues. So back to your question, you're like, what are the causes of hypertension? Hypertension is subclassified into 2. We have the primary or essential hypertension and the secondary or secondary hypertension. For the primary, the reason it's referred to as primary is that there is no known etiology. And that probably is the reason why we've not been able to find a cure for hypertension up till now. So this primary hypertension accounts for about 90% of hypertensive cases. There is no known etiology, and this is what is most predominant. This is what probably passes down hereditary and familial lines. We have another subcategory, secondary hypertension, about 5 to 10% of individuals. So the common things that will likely cause secondary hypertension are things like chronic kidney disease. It's the commonest thing in our environment. Then in younger people, I was looking through this list here, and the use of recreational drugs, however, has become a very major risk factor for
Risk
young
factor.
persons. So you have people indulging in things like cocaine, ecstasy, and all manner of illicit substances. By the time you check their blood pressure, you'll be surprised. They're already showing signs of secondary hypertension. Then, more importantly and most significantly, there's been a lot of urbanization in terms of diet and lifestyle changes. The low cholesterol diet that we were given from our forefathers, there's been a paradigm shift towards more westernized diet, which has high fatty diet. And also our diet is also rich in very much salt now. Most people don't cook at home anymore. So they patronize vendors, they patronize roadside sellers, and you can't calibrate the amount of salt those people put in their meals. For them, their priority is a tasty meal. So if you're always eating outside, you can be sure that you can't calibrate the amount of salt you're taking. So our diet is rich in very high salt. And also, most importantly, sedentary lifestyle. We have a lot of people that are IT workers. They are on their laptop the whole day. They are not doing anything. Or they're working in an office. They are not doing anything. We also have people that are subjected to a lot of stress. For students in Malabo, I can assure you that stress is a major risk factor for hypertension. Some people have to go to school the whole day. At night, they probably have to do a double job or a shift in the night. They have absolutely no time to rest. So inadequate sleep and staying up during the wee hours of the morning when you're supposed to be resting becomes a risk factor of hypertension. The body has a circadian rhythm. That rhythm allows the blood pressure to dip at certain aspects of the day. So if for any reason you're struggling to keep your body awake when the blood pressure is supposed to dip, you're putting yourself at risk for hypertension. So stress also is a major risk factor. But in summary and in a nutshell, primary hypertension, 90% unknown etiology. Secondary hypertension, things like chronic kidney disease, use of alcohol, lifestyle modifications, illicit drugs accounts for, to a large extent, that category.
Oh, that's really
educating.
Yeah, yeah, I would agree. Okay, you mentioned something about circadian rhythm. Malabites and Malabreses. Let's listen to this. So in a situation where you have a student come back from lectures and they've had a stressful day, but then maybe just somehow they have this movie series that they'll be following up. So they decide to stay up in the night to watch a movie series, and then they wake up the next day, they're already so tired to go for lectures, but then they still move on with their day and all of that. So please, what do you have? Please advise this students.
We'll advise those people that they're actually living a very stressful and unhealthy lifestyle. There are two important factors that sleep helps the body. Sleep helps the body to revitalize and nourish itself. During also sleep hours, the basal metabolic rate also lowers. So all the wear and tear that is expected of the body is able to be limited to a large extent. And most importantly, the blood pressure is expected to dip at certain parts, and sleep helps to facilitate that. So if you're awake when you're supposed to be sleeping, the basal metabolic rate will be higher than normal. Wear and tear is more optimal. And most importantly, the blood pressure does not dip as efficiently as it should dip. So it becomes imperative that you should allow your body rest. If you don't allow your body rest, that body will carry you to the hospital and land you in the hospital. Because in the end, despite all the hustle and everything we think we are clamoring for, health is wealth. You need to be healthy to be able to actualize all your dreams and aspirations. If you're not healthy, you cannot actualize anything. So it's important that we take good care of our health by getting adequate rest, relieving stress as much as we can, and engaging in lifestyle modifications that would help to at least alleviate the risk factors for hypertension.
Thank you so much, sir. Thank you. So Malabites and Malabreses, please, when you're supposed to sleep, leave social media, leave movies and rest, please. So now we'll be moving on to the next item on our discussion list. So the next item is signs and symptoms to watch out for. Let's say you have somebody, a friend, it might not be you, a friend that is complaining, I'm feeling that, my body is doing me like this, is doing me like that. What are those signs and symptoms we should watch out for that are pointers to hypertension?
Yeah, thank you for that very important question. And that is why the trust of the World Hypertension Day message is know your numbers. The only way you can know your number is by screening. Today, we actually organized a screening program in the UCTH where we have to check blood pressures for everybody, check blood sugar. We also expect to check blood cholesterol and body mass index. The reason why I'm bringing this to the fore is that in more than 90% of instances, you would have no symptoms for hypertension. So a lot of people are moving around oblivious of anything that is an issue to them. So by the time you start even having symptoms like things like maybe headache, maybe nosebleeds, or some form of discomfort, you're already on the path towards an impending cardiovascular emergency.
Wow.
So in more often than not, a lot of people are moving around. There are no symptoms, and the large proportion of people that are moving around without symptoms are undiagnosed. Actually, the younger generation.
Yeah.
Okay.
That's why the only way to get around this is to go for a screening. So you make it a point of duty. It's either if today is already far gone, before the end of this month, I should go and check my blood pressure accurately. By the time you start having symptoms of hypertension, that means complications are already setting in. You have things like headache, things like nosebleeds and all that. But those things are few and far in between. The unfortunate thing is that most people, their very first presentation will be a complication. This person was moving around normally, the next thing he slumped. What will be the common parlor in our local parlors that village people are at work? It's not village people. That person was going about with undiagnosed hypertension, which was going up rapidly till it became too high, and it led to a cardiovascular complication, which could be stroke, could be heart failure, could be heart attack, could be kidney disease, or as the case may be. So if you're waiting for signs and symptoms of hypertension, it's almost like you're playing Russian roulette.
Wow.
It's a very dangerous game you'll be playing at that point in time. So the only way to get around this, since most of the symptoms are likely to be unknown, is to go and check your blood pressure. And you'll be surprised. A random screen of all the people in Calabar, all the students in Unica, will reveal a significant portion that actually have elevated blood pressures. So since there are no symptoms that are usually apparent in a majority of cases, the only way to do this is to screen. And that's what we're advocating today. Endeavor to check your blood pressure today, tomorrow, before the end of this month, and know that as the first number. The second number to know is to check your blood sugar. The third number is to check your blood cholesterol. And the fourth number is to check your body mass index. So if you're able to do those 4 things before the end of this month, I can assure you that you've done a whole lot of good to your cardiovascular health.
So
that's our message for today.
Blood pressure, blood sugar. Please, you can pick a pen, write it somewhere. Blood pressure, blood sugar, body mass index, and blood cholesterol. So my mama is actually in charge of standing committee on health. And mama, please, when are we having our health week again?
Okay, our health week will be coming shortly by June, ending of June or July. So we are still planning that. We are still putting it in place.
Okay, so we are really planning for the health week. And when we come meet you people, please come out and check your numbers, because we'll have stations there to help Malabites, Malabreses, or any passerby to check their numbers. Please ensure to check your numbers. Even if there are no free health checkup points, or maybe due to a program or so, carry your legs and go to the hospital once in a while to check your numbers, please. You don't have to wait for free health checkup or free this, free that. You can decide to go to Cold Stone or Crunchies to get pizza or ice cream and all of that. You end up spending like up to 10K or so. I'm telling you, to know your numbers, you will not spend up to the amount. You're not spending up to the amount. So please, once in a while, go know your numbers. Go to the hospital and check yourself. You never can tell the undiagnosed condition you are carrying around. And then one day, something happens and they'll be like, village people, please, your village people, sometimes they're just innocent. They don't know anything that's happening to you. So ensure to do yourself a lot of good and be intentional about your health. So now we'll be moving on to the complications of hypertension. My doctor mentioned stroke. Stroke is one thing. I remember when I was little, like I dreaded the thought of stroke. My granddad died of stroke. Not exactly my granddad, though. My step granddad. Yeah. So the family tree is funny, right? He died of stroke. And when I hear stroke, it brings this fear. But when being a medical student, I have gone to the hospital a couple of times, and I've seen so many cases of stroke that is the idea that someone gets paralyzed and all. It's just fearful, right? So we'll talk about the complications properly. So, doctor, what do you have to say about the complications of hypertension?
Okay, thank you for that important question. Like I rightfully stated, most of the risk factors are not known. Or if they are known, they might be non-modifiable or modifiable. And in terms of symptoms, most of the symptoms are likely to not be apparent to a large extent. Complications that are most prominent for those that have been in the hospital, stroke is a very important complication. What hypertension basically does is that we have blood vessels that is like a pipe. It causes a lot of wear and tear
Okay.
on those blood vessels. So that wear and tear over time leads to some level of damage. When this wear and tear affects the blood vessels in the brain, that's when we refer to it as a stroke.
Okay.
So that is just how a stroke comes about. If the wear and tear is extensive in the blood vessels in the heart, it's most likely what we refer to as a heart attack
Okay.
or a myocardial infarction. Same thing for the kidney vessels and all that. You can have kidney disease. So the most common one, or I wouldn't say, well, stroke to a large extent is most common. You have someone that was moving around, you woke up in the morning.
Yeah.
Keep to your hospital appointment,
Yeah.
and I think you'll be good.
You'll be good. You'll be fine. So hypertension is not a death sentence.
Mm-mm.
Yeah, as much as the late stage of hypertension could actually be a death sentence if you don't take care of yourself, right? But then being diagnosed of hypertension in an early stage is not a death sentence. If you can take care of yourself, if you can be intentional with your health, you will do fine. You will certainly do fine. So now, I want to ask my doctor. I know he's well versed, he's well schooled. This man is a scholar. He studies very well. So I want to know if there are latest developments, latest treatments for hypertension. Are there any new things in the health sector right now to manage hypertension, even if it's not yet in Nigeria?
Okay, in terms of treatment of hypertension, there's really not been a radical change in what the treatment model is. The only variant is that the treatment regimen now, there are some slight tweaks. Like we advocate for combined therapies.
Okay.
So maybe if someone was to be on 2 medications, you rather put it as a combined pill. That's what we advocate for now because it helps with tolerance. There is always an issue with, even for our close relatives, they'll tell you that, will I be taking this drug for the rest of my life? You just have to keep encouraging them. Sometimes it can be laborious. Like, I'm taking this drug, when will I stop? So anything that can help with adherence, if the pill burden is less, they tend to comply better. That's what the studies have shown. So there is a more paradigm shift towards combination therapy than monotherapy. In fact, for most of our blacks, they are very unlikely to do well on a single drug. At least from my experience, more often than not, they tend to require 2 drugs. So if you're to put them on 2 drugs, put them on a combination therapy. That is at least ideal for them. So that's been the major change in terms of treatment methodology so far. Lifestyle modification will emphasize a lot. The treatment is complemented by lifestyle modifications. So you cannot be taking drugs and you're still indulging. So if you're treating with drugs, you should shed the weight, stop smoking, reduce alcohol, stop a sedentary lifestyle, reduce stress. When you're able to complement lifestyle modifications with treatments, you tend to have much better outcomes and better results. So it's not mutually exclusive. They must go together. You must accommodate them together at all times.
Oh, that's really beautiful. Okay, so right now, currently, there is something called Asthma Club for people that are asthmatics to join this community. It's more like a community of people that are asthmatics. So I want to ask, as a consultant in the field, if there is any structure like that, maybe like a group chat or something that people that are hypertensive can join in and talk. Maybe they have challenges or they want to share their woes, to share their concerns. They can just come to the group chat and talk or ask questions.
Yeah, we've actually conceptualized that to a large extent, but the problem and the challenge for us is that the burden of hypertension is so vast. If we were to open a club for hypertension now, it will probably take more than 60% of people living in Cross River State.
Oh, wow.
So like asthma, that's the number of people affected by asthma is not of that proportion. A prevalence of 38.1%. That's 1 in 3 adults.
Wow.
It's quite on the high side. So what we tend to advocate is if you're coming for clinic, we have a lot of informative materials. We take out time to ensure that counseling sessions are extensive. We keep encouraging and we keep encouraging. It's not easy to be taking or popping a drug or a pill every day. We must appreciate that problem for a lot of people that are treating hypertension. So we keep encouraging them. Just as you eat your regular meal, take the regular drug at the same time. And in that way, if you can always assure them that the prevention is much more cheaper and much more effective than treating a complication of hypertension, it goes a long way. Because the complication of hypertension can be a heart problem, can be a kidney problem that requires dialysis or requires a kidney transplant. The cost of a kidney transplant in Nigeria currently is 15 million naira.
Wow.
So you don't want to find yourself in that type of situation because at that point, not even state government sponsorship would rescue you because that fund might not come quickly for the kind of urgent treatment you require. So let's focus on preventive medicine. Know your numbers. Know your blood pressure today or before the end of this month. Know your blood sugar today or before the end of this month. Know your blood cholesterol today or before the end of this month. And know your body mass index. You can stratify yourself into whether you're within normal weight, you're overweight, or you're on the obese side. And once you fall into those categories, you should make intentional efforts to begin to reduce that weight. Like I said, obesity is a major risk factor for cardiovascular disease. If you can shed about 10 kg of your weight, the impact on your blood pressure, your blood sugar, and your blood cholesterol cannot be overemphasized. It will make very dramatic improvements on all those three parameters. So we should make a conscious effort to at least ensure that all those lifestyle modifications I highlighted, we follow them through. Continue to seek medical care from reputable facilities. Continue to come for your outpatient checkups and take your drugs diligently. There are no drug holidays. There are no substitutes for antihypertensive drugs. And there is no cure for hypertension. But it can be managed effectively and you can live your life as if you have no problem at all. So we encourage everybody. Hypertension is here with us. It is vast. The only way to ascertain or delineate it is by checking your blood pressure. And I can assure you that if we were to do a random assessment, even in this facility here, and I was to bring a fig and check everybody's blood pressure,
oh my God,
that we might pick someone that has elevated blood pressure that never knew. So once you know you have the risk factors, you have a family member, mother, father, or you're on the big side, your lifestyle is sedentary, you indulge in alcohol, recreational substance, then you should be more vigilant. Your own screening should be much more thorough and meticulous than a regular person. Without checking, you will not find. If you don't seek, you won't find. You bury your head in the sand and say that it doesn't concern me. The first appearance might be a major devastating complication of hypertension, which we don't wish on anybody.
So Malabites and Malabresses, we can't overemphasize this anymore. We have spoken a lot already. We have told you all we have to say. I hope you are listening, I hope this thing is entering your head. Even when you see maybe that lady that is looking to add, she wants to be plus size, she wants to be big and fat and plenty. I don't know what's the rationale behind that. Please, obesity is a culprit. If you stress too. Obesity is a culprit. If you're gaining too much weight, you're enjoying that, telling you are enjoying that, you're feeling yourself. Please, my dear, hit the gym. Or if you don't want to register at the gym, wake up every morning and run. Or do something, just do something to, right? So, sir, please, what's your advice to people that are okay, they are fine, but they have friends or relatives that have hypertension? What will you say to them? What's their role? How can they contribute to the society in managing hypertension?
Okay, the first rule is that for those that are fine, you might be fine today, but you might not be fine in 3 months. So the vigilance does not stop. We are already blacks, we are Africans, and where we are from already places us at a higher risk level. So you should keep being vigilant. You might not have to check as frequently as others, but you are not out of the woods, not by any stretch. So maybe 3 monthly, you should make an effort to check. And then if you have people living with hypertension that are your friends, you should continue to encourage them. Keep reminding them, you had an appointment, or it's been a while you went to the hospital. When last did you go for your appointments? Because there are a lot of dynamics or alterations in the management of a hypertensive that cannot be done by the individual. We need to be sure that the drugs we are giving you are working effectively. People have idiosyncrasies. There might need to be a change in the medication. There might need to be an adjustment in the dose, either upwards or downwards. So the only way you can do that effectively is by coming for your regular appointments. And when you come, we make those adjustments tailored towards your needs. And in that way, you have optimal care at all points in time. So please encourage your friends. You should, at least at this point, if you're hypertensive, you should have a manual or automated feed at home so that you can be empowered. We're in the era whereby patients are advised, if you're diabetic, you have a glucose feed. You can be checking it at your own discretion. You don't have to till a month before you come to check it in the hospital. So that's a level of empowerment that we're trying to get to, encouraging people. And you will be surprised, once people are checking their blood pressure and they're doing well, they are encouraged. It's almost like a stimulus for them to keep doing well. So rather than burying your head in the sand and wait till you see your doctor, you can help yourself by having those equipments that can help you to screen more regularly. You can also screen your friends whenever they come around to visit you. Let me just check all your blood pressures. But you must do it accurately. We didn't say someone is running into your room, you just catch him and check your blood pressure. The person should rest for 5 minutes, should be well seated, rest, and then you measure the cuff and you do it accurately. So you don't go and misdiagnose someone and label someone hypertensive that is not hypertensive.
Okay, thank you so much, sir. So normally, yeah, our phone lines are supposed to be open for question and answers, right? But pardon us, we'll not be doing that right now. Our doctor here has a lot to attend to. He had to leave attending to a patient to come here to talk to us. So please don't take his words for granted, right? But we have something else for you. So our WhatsApp line for messages, if you want to drop messages for us, would ensure to attend to those messages. But note, there is one thing here. Even if we answer your questions online, it's advisable if you have something that is really troubling, condition that is really troubling, right? But it's in the hospital that you can get, in the hospital that you get tested, you go through all the investigation, all the tests you need to run to be sure that you're fine. But if you have minor questions to ask, our WhatsApp line is 080. Okay, this is the radio WhatsApp line. I'll give you my own WhatsApp line personally, so I ensure it gets to me. So just in case Unical Radio does not get this to me, though I'm trusting they should, but I'll just give you mine to be sure of everything. So my number is 08172. This is my WhatsApp line, 08172419474. I'll take that again, 08172419474. So you are free to come to my DM. Hello, patient Omini. My name is this, that. I listen to your talk show on hypertension and I have a question. You can just use that format, drop a question. When I see it, I'm going to attend to it. So thank you very, very much for listening. So at this point, we'll be leaving the studio and we are so glad that you listened, and yeah, have a lovely evening ahead. Thank you. So please, what are your parting words? And
Well, I want to just congratulate and thank the Calabar University Medical Students Association Standing Committee on Health for this yeoman job. I plead that you keep it up. Continue to bring the health advocacy to the doorstep of Malabites and Malapresses. Health advocacy is a continuum. We won't do it all in one day. So always find platforms and opportunities to come back to at least embellish and further strengthen the message we've sent. So hypertension is with us. Everybody should accept the reality. The only way you can ascertain your status is by screening, knowing your numbers, the ones I've highlighted previously. And if you are confirmed as having hypertensive, you start the lifestyle modifications and start the drug treatment. Seek healthcare from a reputable facility and from a reputable medical personnel. Don't outsource your health to quacks and charlatans. Thank you very much.
Thank you. So, Mama, what's your parting words?
Okay, thank you very much, everyone. And I want to especially thank my chief.
Yeah, we are also honored to have him here.
Out of his whole busy schedules,
I saw all the pictures online. He had so many other engagements today.
So we are grateful. Thank you very much. You really impacted knowledge in us. And I promise you, I know Malabites and Malapresses really heard this, and they are going to help themselves. They're going to keep to what the words they've heard today. Thank you very much. Thank you, Patience Omini, for having us here. We are grateful, and I want to also thank all the members of the Standing Committee on Health for this effort they've brought together. It's not just one person; it's a collective effort. Thank you very much. And Malabites and Malapresses will also be coming back to you for our health week, and it's also a time for you all to come out and get tested if you have not been tested before. Thank you very much. Thank you.
And I want to thank Unical Radio 103.5 FM for hosting us today. Thank you, Unical Radio. Thank you, everybody, for listening, and we'll leave the studio now. Bye.